In 1998, Dr. Elizabeth Call, an American trauma therapist experienced in working with refugees, visited the border region and met Dr. Cynthia.
I'm remembering my first meeting with Dr. Cynthia when I first saw her, and just what a presence she had. Very dignified, very quiet, and I guess a brightness in her, just in her being, in her presence. As we're talking, and she was just sharing kind of what her concerns were, it occurred to me, oh yes, I'm a psychologist and a trauma therapist, that's my specialty. I said, I'll bring a team of psychologists back to the border and I'll do what I can to help you.
But if she comes to the clinic with that idea of giving up her baby, you need to talk to her and find out if there's something the two of you can agree on.
With Dr. Call's assistance, Burma Border Projects was born. One of its primary goals was to provide mental health training services to the staff at Dr. Cynthia's clinic. It has done so since 1999.
Our experience with...
But it has also gone on beyond the confines of Dr. Cynthia's clinic by training indigenous medics and community leaders all along the border in techniques of trauma therapy and counseling.
From the very first minute, you communicate warmth, understanding, respect.
Sadly, the medics themselves are often the most in need of this kind of support.
There was a period of time in July of 2002 where they'd had 70 deaths in a 6-month period. So they were dealing with 2 to 3 deaths per week. The medics were horribly burnt out from that and had no idea how to comfort the patients, how to talk to patients about terminal illness, and how to deal with the families. We've worked for 3 straight trips on what is called in this country breaking bad news, and they've become extremely effective at this horrible kind of situation.
Burma Border Project helped us, especially dealing with chronic disease and with many issues of death and how to break bad news to the patients and to the relatives, and to find ways for the medics to cope with the high burden of death and difficult cases.